in this case, I'm going to find the scaphoid and going to mobilize it on the radius, and then I'm also going to find the lunate. So I'm going to find the anatomical snuff box, and I'm going to find the scaphoid, and the wrist is in flexion, and I'm going to bring it dorsal and palmar. Now with the scaphoid now, put the wrist in neutral and bring it dorsal and palmar, and you'll feel that it's a little bit tighter. And then when you go into that full extension, there should be no movement. Same with lunate. So you're going to follow the third metacarpal down till you get to that dip. That's where the capitate is. And then you go a little distal. That's where you're going to find the lunate, or you'll go just ulnar to the scaphoid. And then you'll bring it dorsal and palmar. You're going to fix one with your thumb and index finger. In this case, I'm fixing the radius. I'm going to mobilize the lunate, and I'm going to do it in flexion, neutral, and extension, just to check it tightening. The next one is looking at fixing the triquetral and then moving pisiform and hamate. So remember, we'll find out where hamate is because we follow fourth and fifth down, and that's where the hamate is. If I go just distal to the ulnar styloid and I radially deviate, I'll feel the triquetral pop into my hand. So then I can basically, again, in a flex position, I could fix the ulna and move triquetral, and basically you're moving that TFCC because it's embedded right in the TFCC. If I go just distal and I find the hamate, I can fix the triquetral and move the hamate. And again, we can try different wrist positions for it. And I can fix the triquetral and move the pisiform. But remember, the pisiform, that's where the ulnar nerve comes in. And so sometimes this is a sensitive area, but sometimes you'll get patients who they lean on their pisiform when they're typing and doing a lot of different activities, and then they'll get that sesamoiditis in that. And then when you go to feel it, it's bound down. So that's one of those bones that you can mobilize as well. So then we're just left with the TFCC that we had done, just showed before, and you can mobilize the TFCC, which is essentially moving the triquetral as well. It will have pain or pinching, especially in ulnar deviation and extension, and you might feel some clicking there. There's some taping you can do. You can use a wrist widget in this area as well, and it makes people feel a lot more comfortable.